Okay, Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, guys. I'm sorry, this is actually the last part of the Neuroophthalmology series. And now we went to the front, we go to the back. Now we are at the front again. Okay, we are at the optic disc. Okay, so this is a common picture that you will see if you open an ophthalmology book. So when you were asked to describe your findings, for example, you use a ophthalmoscope, and then you were asked to examine the fundus. Okay, so this is what you will see. Okay, however, please be reminded that the fundoscopic view is very magnified, and the field of view is very small. Okay, so sometimes what you will see is only this. The whole optic disc will fill up your whole fundoscopic view. Okay, sometimes you don't know what is this. What is it? It's orange and large, look like the sun. So that is actually the optic disc. It's very bright yellow, very bright yellow. But when you describe it, you must say that the optic disc is pink. Okay, because it actually refers to the circulation on top of the optic disc. If it's not yellow, you call it pink. Alright, dusty pink, something like that. Okay, so start with the color of the optic disc. So the optic disc is pink, and then you look at the margin. Okay, the margin is well-defined margin. Healthy neuroretinal rim is optional. Okay, you don't have to tell if you don't know. Okay, and then the cup to disc ratio is 0.3. This is the cup. The whole thing is a disc. Okay, and you must also describe the blood vessels. This is the retinal vessel. Remember, not the choroidal vessel. You don't have to describe. You don't have to measure the choroidal vessel. You just say that this is the artery, this is the vein, and the ratio is 2:3. That is normal. Okay, if you see a lot of choroidal markings, a lot of large choroidal vessel behind you, then you see that it's a thyroid fundus. Okay, you can see that. Okay, all right. So this is, remember this is a normal picture of an optic disc. Okay, the margin, very nice. Okay, how about this one? Okay, look at this. This is the swollen optic disc. Okay, picture number 1. This is the margin is not clear, isn't it? The margin is not clear. And how about the color? How about the color? The color is very red. This is not pink. This is hyperemic. Hyperemic, and then the blood vessel is probably a little bit swollen. And tortuous. If you see carefully, you can see the tortuosity. Alright. And then, look at this. How about this one? If you are unable to see the margin like this, clear margin, you must say that the optic disc is swollen. Okay, this is swollen. This one is also not clear, and then you see some hemorrhages near the disc. All right, you cannot see the cup. If a swollen disc, you will never be able to see the cup. Okay, so and then it can be either of these, can be the papillitis or whatever. All right. But this one, bilateral optic disc swelling, you tengok, you see the margin, it's not clear, and you can see that actually the optic disc is like bulging out. So that is definitely swollen. Okay, they say like a champagne cork bottle appearance. Okay, this can be due to papilledema. This can also be due to malignant hypertension. Okay, and then when you describe the optic disc, the color, the margin, the cup, you cannot see the cup, and then you go to the blood vessel. Is it 2:3? And then you go to the color of the retina. It looks normal. the retina looks normal, and then this black dot is the macular. See, the macular is normal. It's normal to be dark like that. Okay, it's normal. Okay, and then you go here, this picture, you cannot see the optic disc. Yeah? It's been obscured, it's swollen. Okay, and you see a lot of black patches. Actually, these are all blood. Okay, so what is this? This is central retinal vein occlusion. Okay, we will go to that later, okay, on the other lectures. Alright, so these are basically the causes of swollen optic disc. So remember, one of the main cause is malignant hypertension. So please, if you see patient with a headache, vomiting, headache, vomiting, reduced vision, sometimes the vision is normal, don't forget to check the blood pressure. Okay, because malignant hypertension can also cause this. Alright. Okay, so basically what happens in, how do you describe a swollen optic disc? The optic disc is actually elevated, is blurring of the margin, obscuration of the retinal vessel at the margin. This one, obscuration of the blood vessel at the margin, hyperemic, dilatation of the optic disc, of the capillary vessel. This one dilated. This one especially dilated. Peripapillary hemorrhages. This one, okay. Sometimes you can see retinal fold, choroidal fold, macular edema, and even loss of venous pulsation. And clinically, a patient can have blind spot, enlarged blind spot. Okay. Okay, we go specifically into papillary edema. Papillary edema is basically refers to disc swelling secondary to raised ICP, intracranial pressure. Okay, how does a patient present to you? Patient can have headache, and the headache is actually worse in the morning. And when patient bend over, patient will say the headache is worse. And if patient have vomiting, it's described as projectile vomiting. Patient can even have diplopia, sixth palsy. Okay, so what are the causes of raised ICP? Can be many things. Can be the most important life-threatening cause is space-occupying lesion. Space-occupying lesion in the form of probably blood hematoma, probably tumor, brain tumor, probably cerebral abscess. Okay, anything that occupies the brain. Okay, you know the brain is like a closed vault with a hole at the spinal cord. So if the pressure is too high, the brain will be pushed down at the foramen magnum. That is called coning. Patient, how does the patient die during coning? The respiratory, depression, the center are all there. So if it's being compressed at the foramen magnum, patient will die. Okay, so don't forget about papillary edema and space-occupying lesion. And you must send the patient for an imaging, a CT scan, urgent CT scan. If patient have all these criteria, sometimes a few criteria also enough. Okay, and then so you send for an imaging. So and then you will see, is there any occupying lesion? If it's normal, then fine. You check the patient's blood pressure. Probably the blood pressure is high. If everything is normal, probably it's intracranial hypertension. Patient needs lumbar puncture. Or it can also be idiopathic, can be secondary to drugs, and it can also be due to some endocrine causes. Okay, please remember this, because this is what you do. You save patients' life. You must know all these red flags. all these red flags. Headache in the morning. Usually people got headache after in the afternoon, in the evening, when they watch video for too much. They got fed up with the lecture. There is tension, headache. But headache in the morning is worrying. All right. Okay, so we have gone to swollen optic disc. Now we go into pale optic disc. Okay, what is pale optic disc? You look at the color. There is no more pinkish hue. Okay, it's like pale, like pucat, like that. Okay, so this is pale optic disc, well-defined margin. The cup is still 0.3, or maybe you cannot see the cup, or the cup is too big. Okay, that one you will learn in your glaucoma lecture. So it can be due to congenital causes. You were born with pale optic disc, so definitely your vision will be poor, or you can be blind. Okay, and it also can be secondary. Secondary causes is a lot. Secondary to chronic raised ICP. For example, this patient, you didn't treat the patient, or patient didn't go to the hospital, and finally, after 2 months, 3 months, the optic disc died. Pale optic disc means actually the retina, the fibers are all almost dead. Okay, so secondary to chronic raised ICP, secondary to vascular retinal diseases, secondary to optic neuritis. So in optic neuritis, initially patient presents with optic disc swelling, but later on, after 3 months, 2 months, when the nerve died, the optic disc become pale. It can also in the form of atrophy. You can call it optic atrophy. Okay, secondary to chronic optic nerve compression, secondary to trauma. Yes, definitely. This one is called traumatic optic neuropathy. And secondary to advanced glaucoma. Okay, those all can cause optic atrophy, pale optic disc. Okay, I hope you can understand all that. So, in a nutshell, you must think a lot about those life-threatening causes. Life-threatening first, okay, and then vision-threatening. Okay, and then you must err to the side of caution. You must be very careful in what you do, and do not do any harm to your patient. Okay, I hope you have enjoyed my series of lectures. I hope you can learn something, and please do some revision. Hear this over and over again, and then perhaps we can discuss it when we see face to face. Okay, bye. Thank you very much for watching.